This is part 4 in my weaning and extubating patient series. And in this part of the series, we're gonna be talking about the spontaneous breathing trial, also abbreviated SBT. At this point, your patient has been screened to make sure it's safe to wake them up. They are ideally weaned off or on minimal sedation. They have been screened to see if they can safely be on a breathing trial. And now we are going to actually put them on a breathing trial. So at this point, I will call my respiratory therapist and be like, hey, patient's off sedation, they're awake following commands, can you come put them on a breathing trial? And at my hospital, the RT will come by. Then the patient should be allowed to breathe through either a TP circuit or they can be on a vent circuit with a CPAP mode. So continuous positive airway pressure of 5 centimeters of water or a pressure support ventilation of less than 7 centimeters of water. We are going to do this for about 30-ish minutes up to 2 hours, and we are going to assess to see if our patient has any of these things happen to them. So while your patient's spontaneously breathing, is their respiratory rate more than 35 or less than 8 breaths per minute for a sustained period of 5 minutes or longer? Are they having any hypoxemia of SATs less than 88% for at least 5 minutes? Are they having any changes in their mental status, meaning they suddenly just aren't responsive, or maybe they are super agitated and anxious? Are they having any acute cardiac arrhythmias or 2 or more signs of respiratory distress? Tachycardia, bradycardia, use of accessory muscles, abdominal paradox, or diaphoresis. If your patient checks any of these boxes, we're going to return back to the start and reassess in 24 hours if it is safe to wake up your patient again and put them on a breathing trial. If your patient is crushing it, we are going to notify the provider and consider extubation. And I'm going to be talking about extubation criteria and things that we look for, weaning parameters, in the next video.